Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our program today is all about the hip, and joining us for that discussion is board-certified orthopedic surgeon, Dr. Lenoard Karadimas. Dr. Karadimas, welcome back to Today's Health.
Glad to be back here, Barb.
Always like to start with anatomy. Can you tell us about the anatomy of the hip?
Sure. So we're talking about the hip, and the hip is a pretty basic anatomy. Actually, it's kind of a ball and socket joint. So this is the ball we're talking about here is called the femoral head. The socket is the acetabulum, and that basically makes up your hip joint. There's also a little smooth white cartilage at the end of the bone, like all our joints. There's also a little cartilaginous cushion that sits on the periphery, on the edge of that socket, called the labrum. And then you also have a capsule structure that sort of wraps around the whole joint. So that's basically, generally, we're talking about a ball and socket joint is our hip.
So what are some of the main causes then of hip pain?
The main cause of hip pain is going to be degenerative arthritis, wear and tear arthritis, where the cartilage, and this picture shows it here, the cartilage that's smooth white, in this model it's showing it pink, but it's actually smooth, shiny and white, that cartilage wearing down at the end of the bone. That is predominantly the main thing that causes hip pain. You can also have spurs that can form around the hip joint, usually in this area right here. You can have spurs that form from just wear and tear and sometimes anatomy issues, and you can also have tears in the cartilage or labrum in the hip.
Well, let's talk a little bit about arthritis. I know there's different kinds. Can you tell us about that?
So there's basically two kinds in general. There's wear and tear osteoarthritis, and then there's the inflammatory type of arthritis, like a rheumatoid arthritis. And that's going to be a very small percentage of the patients we see who have this autoimmune type problem. Predominantly, when people have arthritis, which is basically losing the cartilage at the end of the bone, whatever joint we're talking about, predominantly it is osteoarthritis or wear and tear or degenerative.
So what are the symptoms then, other than pain? You've talked about pain, but problems in the hip, what are the symptoms?
Very specific for the hip. People who have true hip problems are going to have groin pain. They're going to have pain in that groin area. It can occasionally radiate down into the thigh. You can have pain on the outside of the hip or in the buttock area, but for the most part, we see people having groin pain, and that can limit their ability to move their leg around. They have a hard time getting in and out of the car or putting their sock on or putting their shoes on, those kinds of things. Eventually, over time, it can cause people to limp.
That's what I was just wondering, are people going to be limping with this kind of pain? But all the other places that people have pain may not necessarily be because of their hip joint. Is that correct?
It is correct. But again, very, very, very specific to the hip is that groin pain and radiating down into the thigh area. When you have groin pain, usually there's nothing else. I mean, sometimes it can be your back, but if it's causing you to limp and have problems getting, doing certain things, it usually is your hip.
Yeah, and I'm thinking most people think my hip is my hip, so they're not thinking of that groin pain.
Right. I'll have people that come in the office and they'll complain. They'll say, "Oh, my hip hurts," and it's their buttock area or laterally, and that can be more like a sciatic nerve problem and not their hip at all.
Okay, so if you do have groin pain, does it always progress, and when do you need to see your doctor?
Right, so you can have groin pain for other reasons as well. You have, there's other soft tissue structures around that hip girdle. There are tendons and muscles and those kinds of things. So you have muscular strains, sprains, groin pulls. Athletes will get groin pulls, those kinds of things. And I think, again, resting them, activity modification, anti-inflammatories, and simply giving it time to see if it goes away is the way to go. But if you have persistent problems like any other joint, persistent pain, persistent issues, that's when you want to have it evaluated.
Okay, well, let's take a break. We'll be right back.